going to perform a session on safety precautions during first trimester of pregnancy. So before we begin, I want to give our audience a general insight on BabyChakra. During I want to tell what BabyChakra is all about. BabyChakra is India's largest pregnancy and parenting platform. It is a one-stop destination for pregnant women and expecting parents. We try to connect parents with experts who bring valuable information and research-based information to all. On that note, I would like to kickstart our topic for today, and we are going to have an informative discussion today on safety precautions during first trimester of pregnancy, and we have an amazing lineup of guest speakers with us on board. So please welcome Dr. Richa Neel. And Dr. Richa Neel, can you please introduce yourself?
Hello, myself Dr. Richa Vaghasia. I am a guardian. I'm practicing in Lotus Women's Hospital and IVF Center. And yes, in this hospital, this is a place where we are talking about women's problems.
Okay, thanks for joining us today and sparing some time to bring lots of useful and helpful information to our viewers. Dr. Yatri Thacker, could you please introduce yourself?
Hi, everyone. I'm Dr. Yatri Thacker. I'm a holistic homeopathic physician, a mental health expert, and the founder of Baby and Me programs. I've been practicing in Mumbai for over 2 decades now. And I have been privileged to, take a lot of training sessions for corporates, even a lot of NGOs. My whole motto is to spread awareness on care and cure, and especially my heart goes out to the pregnant women's and children till from 0 to 5 years of age, where we club in homeopathy with a lot of educational sessions.
Okay, thanks for joining us. I would like to say Dr. Yatri Thakker is a holistic homeopathic physician, mental health expert, and founder of Baby and Me programs. She's a Dada Saheb Phalke awardee practicing at Mumbai 19 years. Yeah. So proceeding with the session, I'd like to ask a few questions. Before that, I would say every stage of pregnancy brings different issues and concerns. Use this part of the guide as a roadmap to the first trimester of your pregnancy. And let's begin with the discussion and indulge in the conversation with our experts in the panel today. And we shall introduce the topic in the depth. So, my first question is for Dr. Richa. What are the precautions to be taken during first 3 months of pregnancy?
First of all, when the patient and the woman can see the 2 lines on the urine pregnancy kit, it's a very wonderful feeling for her to let her congratulate. But with this positive result and this wonderful feeling, one responsibility is also announced there. कि आगे जाके फर्स्ट 3 months या during this 9 months हमको क्या precautions रखने to help proper growth of the pregnancy so that the baby is properly growth, कोई abortion आगे जाके ना हो जाए. So today we will talk about what precautions to be taken during first 3 months, that is first trimester of pregnancy, what to do, what do's and don'ts of this first 3 months, about diet and exercise, all we will talk about today. So first of all, when the result of 2 lines on this UPT test get positive result, first of all go to the doctor, do checkup of the pregnancy, that is uterine pregnancy is properly growing or not. Then the second step will come after checking, doctor will check everything, and then he or she will guide about proper medications to you. They will put on the folic acid tablet, that is very important for the neural tube growth, so that any anomaly will not happen in the baby. The taken during pregnancy first 3 months is that stop taking alcohol. There is no safe limit of any amount of alcohol during pregnancy. So stop taking alcohol, otherwise it will cause fetal alcohol syndrome. Second thing, to stop smoking. It will also harm the pregnancy and the growth of the baby. It might cause preterm labor, preterm delivery also. And also if limit the caffeine intake, like every day per 200 gram of caffeine is safe, like a half cup of coffee, not more than that. Other things are the cold drinks and also tea that might have a small amount of caffeine also. So limit the caffeine intake. Then some people get nausea, feeling nausea and vomiting in very much amount that is called hyperemesis gravidum. And someone will not feel the vomiting or nausea. And if जिसको vomiting nausea ये feeling हो रही है, they people should take some dry breakfast like toast, biscuit, khakra in the include in the breakfast, and cut it into the interval, small amount पे frequent diet लो, rather taking it totally full diet in one time. So it will reduce your nausea feeling. Second most important content is a ginger that will decrease your nausea feeling. So you can take ginger tea or some ginger capsule also. So it will help you to get reduce the nausea feeling also. Then in the proper talking about that in the pregnancy. So stop taking oily and spicy food. Already in the first trimester of pregnancy, there are some hormones like HCG hormone, human chorionic gonadotropin. It will increase, so it might it also cause the constipation and the bloating stomach and heaviness. So after that, along with taking this spicy, oily food, you will worse the condition. So stop taking oily and spicy food. Take some light, healthy food, like fruits and vegetables, salads, maximum milk, maximum water intake. You should take in fruits, especially the one should avoid the pineapple and papaya. These two things, and all citrus fruits like orange, it's a very avocado. It is a very safe during the pregnancy. Apple, banana, and things. Like, and if anyone is non-vegetarian, so they should take properly cooked meat or a chicken. It's not to take any raw food, raw non-veg food, and also to avoid some fish like shark hai, stamel hai, because they have a high mercury content. So it is not safe during the pregnancy. So stop taking that food also. Otherwise, you can take the boiled egg and any products from the properly cooked food. Otherwise, one should follow during first 3 months of pregnancy. And if we are talking about the exercise during first 3 months, so one can do some minimal lightweight exercise, not any vigorous exercise. Like
Okay.
one can do walking hai, jogging hai, pilates, then this is squatting postures, prenatal yoga things. So one this exercise for 10-15 minutes every day. If someone can feel the pain or anything else after this taking exercise, so please not try other exercise by own. Instruction of the some physiotherapist, the pregnancy exercise expert. Do not do it by your own if you are facing some problems. Otherwise, these all light exercise are very helpful because 3 months of pregnancy they will reduce your backache, body ache, pain, and also to get takes more oxygen. It will help in the proper growth of baby also. So these are some things about what one should follow for the diet and the exercises. Okay, and
Yeah.
if uh, someone has previous 1 or 2 abortions हो गए, so then they should take some rest also. It's not the bad rest because the natural pregnancy is itself very strong. So it need not
Yes.
yes. टोटली बेड रेस्ट की इसको जरूरत नहीं होती है, बट दिस प्रिकॉशंस वन शुड टेक इन, प्रिकॉशंस लेके रखो, इट विल नॉट कॉज इट अगेन.
Right,
सही
right,
से
Dr. Richa.
प्रिकॉशंस ध्यान में रखने होते हैं.
Yes, that's indeed an insight, Dr. Richa. So I would like to proceed with the next question for Dr. Yatri, and I would like to ask, like, is homeopathy safe during pregnancy?
Yes, homeopathy is absolutely safe during pregnancy, even during breastfeeding and post delivery, all the three phases. The reason is, homeopathy per se was first, it was introduced or it was experimented on healthy human beings. That's how the homeopathy medicines are made. First, a healthy human being takes it, whatever the symptoms are, come up, accordingly, the remedies are made. It is, over about, many years people are practicing homeopathy, and we can see amazing results once you take it. It doesn't have side effects. It's a gentle way of treating patients and highly effective. In fact, there are certain cases where you can take as a combination with your allopathy or your multivits. There is no harm in that. And you will see the changes. For example, if a patient has morning sickness or nausea, there are certain amazing homeopathy remedies for that. Usually, the allopathy side would be an anti-emetic or a Domstal, that means an antacid or something for vomiting. Whereas, what does homeopathy do? What we do say, if I have three patients with the same complaint of morning sickness and they all three are pregnant, yet my homeopathy remedy will differ for all three of them. So we follow the rule of individualistic. Depending on the signs and symptoms, we give them homeopathy, and you can immediately see the difference in their problems. So I would say yes, it's absolutely safe, a gentle and the sure shot way of treating patients.
Yes, thank you, Dr. Yatri. So we would proceed with the next question for Dr. Richa. Dr. Richa, what are the do's and don'ts during the first trimester, and the role of exercise and diet, which you have already emphasized on? Just please
Yes.
elaborate a little bit about it.
Okay. So the first trimester of pregnancy is the first 3 months. It is about time. ये एक फर्स्ट trimester का जो टाइम है, दैट इज द टोटल फीटल ग्रोइंग पार्ट. इसमें जो फर्स्ट 3 मंथ्स में मैक्सिमम द फीटल ग्रोथ इज मैक्सिमम होता है, कि जिसमें हमको कुछ प्रिकॉशंस रखने होते हैं कि बेबी का ग्रोथ प्रॉपरली हो, बीच में कुछ एनोमली या कुछ ब्लीडिंग या कोई इश्यू ना आ जाए. तो उसके लिए प्रॉपर डाइट एंड एक्सरसाइज ज़रूरी है. डाइट में जैसे कि मैंने आगे बताया कि स्टॉप टेकिंग अल्कोहल, स्टॉप स्मोकिंग, लिमिट द कैफीन इनटेक, एंड डू प्रॉपर exercise in the first semester, very light exercise, not a vigorous exercise. So there's a no load over the lower abdomen, so the pain will not start, and the bleeding and the will not start.
Yes. Thank you, Dr. Richa. I would proceed with the next question for Dr. Yatri. Dr. Yatri, which homeopathic remedies are advised in the first trimester usually, like for morning sickness, constipation, breast tenderness, backache, heartburn, and so many other issues which occur in the first trimester?
Yeah. So, as I mentioned, though there are specific remedies in homeopathy, if you want to really treat a patient, then the most important thing is the case history, because we want to know how different or how individually a person is suffering from that kind of, problems or symptoms, and accordingly the remedy is given. So, per se, but I will give you names. Before that, I want to explain certain things, how homeopathy works during pregnancy and why I would want patients to administer it. So when you administer homeopathy medicines, there are various ways of, मैं हिंदी में भी बोलूंगी, आई थिंक काफी लोगों को हिंदी भी सुनना है. होम्योपैथी लेने के काफी अलग अलग तरीके हैं. या तो आप पिल फॉर्म में ले सकते हैं, जो मुंह में डाल के आपको खाली चूसना है, या तो लिक्विड फॉर्म में भी आप ले सकते हैं. दोनों का इफेक्ट क्वाइट सिमिलर है और काफी सेफ होता है होम्योपैथी प्रेगनेंसी के वक्त. अभी ये कैसे काम करता है, आप एक्चुअली, ये बड़ा मिथ है या ये जाना जाता है कि होम्योपैथी बहुत स्लो काम करता है, बहुत टाइम लेता है, ऐसी बात नहीं है। इट डिपेंड्स आप कितने टाइम से वो डिजीज को सफर करते हैं। फॉर एग्जाम्पल, अगर आपको आर्थराइटिस 10 साल से है तो आपको कम से कम 6-8 महीना कुछ फर्क लगेगा दिखने में। और अगर आपको डायरिया है 3 दिन से, आप बिल्कुल 24 घंटे में देख सकते हो होम्योपैथी में कितना फर्क हो सकता है। ठीक है, सो पहले तो ये बात आपको बिल्कुल अपने दिमाग में डालनी है कि होम्योपैथी ऐसा नहीं है कि बहुत टाइम लगाता है। इट डिपेंड्स फ्रॉम केस टू केस. It depends on how long you are suffering from that disease, and depending on your symptom, you are given a remedy. अभी ऑफ द शेल्फ रेमेडी लेने, अगर आपको लेना है ऑफ द शेल्फ मतलब आप दुकान में जाके, मैं जो 2-4 नाम दूंगी वो जाके आप लेंगे, तो उसमें आपको ये ख्याल रखना है कि आपको जो पोटेंसी, मतलब जो मिलीग्राम जो बोलते हैं ना एलोपैथी में, उसकी पोटेंसी हम बोलते हैं, वो सबसे लोवेस्ट लेना है। क्यों? ताकि आप प्रेग्नेंट हो, जब आप प्रेग्नेंट होते हो, आपकी सारी बॉडी हेड टू टो एब्सोल्युटली सेंसिटिव हो जाती है। जैसे किसी को दांत का दर्द, किसी की स्किन बहुत फ्लेयर अप होने लगती है, टेंडरनेस ऑफ द चेस्ट और द ब्रेस्ट एज वी से, किसी को कॉन्स्टिपेशन, तो आप हाईली सेंसिटिव बन जाते हैं। तो होम्योपैथी वाइज आपको सबसे कम डोज लेना है, वो इफेक्टिव होगा पर आपकी सेंसिटिविटी भी दूर करेगा। पर ज़्यादा इफेक्टिव ये रहेगा कि आप एक अच्छे से एक्सपीरियंस होम्योपैथिक फिजिशियन के पास जाए, जो आपके सिम्टम्स लेके आपके बॉडी की सेंसिटिविटी के हिसाब से आपको वो पोटेंसी दे। ठीक है, सबसे पहले तो ये बात है। नाउ द सेकंड दैट आई वांट टू इंसिस्ट, एंड वी आर टॉकिंग मोर अबाउट द फर्स्ट ट्राइमेस्टर, दैट मीन्स द फर्स्ट 3 months. What usually happens is by the time they are in the second month, तभी उनको डायग्नोज होता है, अरे मैं प्रेग्नेंट हूँ, क्योंकि वो आपका फर्स्ट पीरियड मिस हो गया है ना, तो ऑलरेडी 1.5-2 months चले गए, तो आपके पास सिर्फ 1 महीना रह गया फॉर द फर्स्ट ट्राइमेस्टर। अभी क्या लोग करते हैं, काफी लोग जिसके स्पेशली इरेगुलर पीरियड्स, मिस पीरियड्स ऐसा होता है, उनको समझ में भी नहीं आता है। तो सिम्टम्स पहले आपको नोटिस करना, आपकी बॉडी में ऐसा क्या चेंज हो गया, क्या चेंज आप देख सकते हैं। जैसे मैंने बोला सेंसिटिविटी, तो जो ब्रेस्ट का कलर है, जो डार्क एरिया अराउंड द निपल, वो चेंज हो जाता है। किसी किसी को मूड स्विंग्स होते हैं। ऑफ कोर्स द फर्स्ट सिम्टम्स इज कि आपके पीरियड्स मिस हो गए, और इमीडिएटली गायनेक के पास, कोई भी एक्सपर्ट के पास अब जाके आपका टेस्ट करवाइए। ऐसे ही इवन आप होम किट करेंगे, पॉजिटिव आया, फिर भी आपको यूरिन टेस्ट, HCG जैसे डॉक्टर रिचा ने बताया है, वो करना है आपका श्योर शॉट। अभी आपके पास 1 महीना रह गया, जब आपको जैसे सिम्टम्स होने लगेंगे, जैसे ज़्यादातर हमने देखे हैं मूड स्विंग्स, ब्रेस्ट टेंडरनेस, हल्का हल्का हेडेक होता है, किनको एक्ने, पिंपल्स आ जाते हैं फर्स्ट 2-3 months में ही, किसी किसी को सिवियर एसिडिटी होती है लीडिंग टू माइग्रेन हेडेक्स, there are some who get morning sickness. Now, write down the names of the remedies that I'm giving you, but I'm telling you, don't pick up off the shelf if you want to see real effects. Okay, so the first one for morning sickness with nausea, it's Nux vomica. Take Nux vomica 30. The second one, if you have too much vomiting, which is with the smell of the food, take Colchicum 30. The third one, if you have excessive vomiting, जो बिल्कुल stop नहीं हो रही है, no matter what you do, Epicac 30. ठीक है, ये 3 नाम लिख ले। अभी होम्योपैथी में एक मल्टीविट होता है ना, जैसे हम फॉलिक एसिड लेना तो जरूरी है, बिल्कुल आपको स्टॉप नहीं करना है, पर उसके साथ एक होम्योपैथी रेमेडी कॉल 5 और 6x, अगेन 6x, एकदम कम डोज में एक बड़ी सी गोली दिन में 3 बार आप आराम से ले सकते हैं विदाउट एनी साइड इफेक्ट्स। अगर आपको बहुत मूड स्विंग्स हो रहे हैं, आपको लग रहा है अरे क्या हो रहा है, मैं कभी रो रही हूँ, कभी हंस रही हूँ, कुछ हो रहा है, तो एक रेमेडी होम्योपैथी का नाम है काली फॉस। Kali Phos 6x, take 1 pill 3 times a day and you see the difference. If you are severely constipated and बहुत ज़्यादा हार्ड स्टूल्स आ रही है, आपको बहुत प्रेशर लगाना पड़ता है, तो ये रेमेडी, उसका नाम है ब्रायोनिया 30, वो आप 3 pills 3 times a day ले सकते हैं। Now, I want to tell you all, अगर आपने रेमेडी ली और 3 दिन, I'm saying 3 days, it acts really fast. In fact, मेरे एक्सपीरियंस के हिसाब से 24 घंटे में फ़र्क देखती हूँ पेशेंट से, पर 3 दिन में आपको कुछ भी फर्क नहीं लगा, प्लीज गो टू एन एक्सपीरियंस होम्योपैथ फॉर योर होम्योपैथी रेमेडी। डोंट सेल्फ prescribe and self eat the medicines. Okay, now comes for the tenderness of the breast. If people have severe tenderness, which is again a common symptom, try and for during pregnancy आपको ये ज़्यादा से ज़्यादा ट्राई करना है कि आप ज़्यादा से ज़्यादा होम रेमेडी पहले करें, प्रिकॉशंस ले, फिर आप रेमेडी चाहे एलोपैथी होम्योपैथी में जो है, ठीक है, क्योंकि दैट्स द मोस्ट सेफेस्ट वे टू टेक केयर ऑफ योर सेल्फ एंड योर बेबी, है ना। तो जब बहुत टेंडरनेस है तो आप कोल्ड पैक और वार्म पैक का ऑल्टरनेट थेरेपी कर सकते हैं आपके ब्रेस्ट पे, जो आपको काफ़ी फर्क लगेगा उसके बाद। या एक होम्योपैथी रेमेडी, उसका नाम है कोलोसिंथ, कोलोसिंथ 33 pills 3 times a day. Take it and see the difference. You will definitely see a difference. Okay, there are, in fact, I can go on and on, but I think I'll give up to her because I have seen the results even for normal delivery. During the pain, to ease out the pain, there are certain homeopathy remedies. So throughout 9 months, one can take it very, very easily. Okay?
Yeah. Thank you, Dr. Yatri. That is where the question from audience has popped out. Can I take homeopathic remedies while pregnant and throughout pregnancy? So I think you have already answered it pretty well.
Absolutely, yes. In fact, post delivery and for your child, in fact, we give remedies for a newborn also if they have some problem. Okay, but do follow the tips and everything that I just told you.
Yes, definitely. And you should always consult an experienced homeopath for the medicines. That is also worth emphasizing. Yeah.
Absolutely.
So the next question from the audience is for Dr. Richa. When to worry about the discharge during first trimester?
Okay. So small amount of discharge is very common during the pregnancy. Very watery discharge, a minimal amount of white discharge is normal. But if there is some changes seen in the discharge, like any foul smelling discharge, excessive of the day, and one should keep the panty liner for that, then उसको डॉक्टर के पास जाके एक बार एग्जामिनेशन कराना चाहिए. It may be due to some infection also. So after checking and proper examination, then doctor can give her the medicine for that. So not ignore the problem. If it is very much small amount, it is okay. That's also normal thing. So during first 3 months, if the discharge is excessive, it is a foul smelling, any change in the color like green or mixed yellow color type of discharge, any false occur, excessive discharge. So one should consult the gynecologist, and after checking examination, then take the medicine according to advice of the doctor.
Yeah, thank you, Dr. Richa. The next question is for Dr. Yatri. Are there any risks of using homeopathy during pregnancy?
No, there are not any risk, but one thing definitely be sure, use the lowest potency during pregnancy, not the highest. Highest हमारा DMCM तक जाता है. Don't try doing. I know people, they do various things with it, but I would strongly advise no, just take 6x or maximum 30. That's the potency they'll use. But apart from that, there are no side effects when you take homeopathy.
Yes. Thank you, Dr. Yatri. Next question from the audience is for Dr. Richa. After miscarriage, if a person is conceiving after 3 years, then should the person take complete bed rest? And currently she's in 7th week of her pregnancy.
फर्स्ट तो ये केस में जो पेशेंट का प्रीवियस मिसकैरेज है, इतने टाइम बाद इस प्रेगनेंसी कंसीव हुई, इट इज वेरी प्रीशियस प्रेगनेंसी फॉर देम. So, but as I said previously, कि pregnancy itself very strong by nature. So nothing like a bed rest, complete bed rest. ऐसा कुछ प्रॉब्लम से अकॉर्डिंग के साथ में ब्लीडिंग हो रहा है या स्पॉटिंग वजाइना से हो रहा है या सीवियर एब्डोमिनल पेन है, एनी प्रीवियस हिस्ट्री ऑफ समथिंग यूट्राइन एनोमली, यूट्रस की कोई एब्नॉर्मलिटी है, तो उसके अकॉर्डिंग जब डॉक्टर चेकअप करते हैं एंड बोलते हैं इनको बेड रेस्ट की जरूरत है तो अदरवाइज pregnancy just because of miscarriage one should do complete bed rest. It is not needed also.
Okay.
But some precautions, if previous miscarriage is there, some precautions the one should take during the current pregnancy, that do not travel for long, do not travel in the ad also, and in the first trimester some symptoms may also see, like किसी को pimples बहुत सारे निकलते हैं या स्किन फ्लेयर अप होती है, the blackening of cheeks होते हैं. So do not take the medicine over the counter. Do not take the self medicine. First consult the doctor, and according to their advice, then only take some medicines. Otherwise, it will get harmful effect on the baby also. The growth properly not occur. And if previous miscarriage ki history hai, then immediately when your periods is missed 2 or 5 days above your last menstrual period, then consult the gynecologist, first do some checkups, and according to doctor's advice, start taking medicines properly. So the second time the history will not repeat.
Yes. Thank you, Dr. Richa. Like we would be ending with the questions now, as we are already running out of time. So I would like to take one takeaway message from both of you. We would proceed with Dr. Yatri first. Your takeaway message, Dr. Yatri.
So, my takeaway message for all the pregnant moms out there and all the listeners is, it's not going to be easy during this 9 months, but every day will bring you closer to your baby. So, cherish this time, enjoy this time, and give your best and just be happy.
Yes. Thank you. That's really wonderful message, Dr. Yatri. Dr. Richa, your takeaway message.
My takeaway message to all the listeners, to all pregnant women, is that the pregnancy is a little bit tricky, but it's not risky if you are taking some precautions. Enjoy and go 9 months. This just I say take it easy and do according to your doctor's advice, and just take some precautions in mind, so you will not get any problem throughout your 9 months.
Yeah. Thank you. Thank you so much, Dr. Richa. Now we would like to conclude the session. Thanks a lot for joining us today. The tips you have provided are extremely insightful, helpful to all of us, and I'm sure all the moms and dads out there are finding it very, very useful. With that, we come to our live session's end today. And thanks to our wonderful viewers who have joined us. And thank you, experts, for sharing so many helpful pointers with us. And do keep following us on Baby Chakra and stay tuned for more helpful parenting advices, videos, and tips. Thank you.
Thank you so much for having us over on BabyChakra. It's truly one of the platforms which unconditionally wants to reach out to interiors of India and everywhere globally too. So keep tuning in. One of my favorite apps, and thank you again for having us over.
Thank you.
Yes.
Thank you, BabyChakra. It's a wonderful app that one stop platform for the every pregnant woman who get every advice, every tips from this. This is very wonderful app.
Yeah. Thank you. Thank you so much.